In this lecture, we will review the history of psychoanalytic theory and the difference between psychodynamic and psychoanalytic theory. What is psychoanalysis? And of course, Sigmund Freud, his many contributions, as well as his many criticisms. Psychoanalytic theory, developed primarily by Sigmund Freud, is a theory of personality and a method of psychotherapy. It posits that unconscious mental processes influence behavior and that early childhood experiences shape personality development. Freud's work, beginning in the late 19th century, focused on the unconscious mind, dream analysis, and the impact of repressed desires and behavior. Psychoanalysis is a talk therapy that aims to treat a range of mental health issues by investigating the relationship between the unconscious and conscious elements of the psychological experience using clinical techniques like free association and dream interpretation. I thought it was very important to know the differences between the two. Now, contemporary psychoanalysis has evolved a great deal from its roots in the classical Freudian approach, which developed in Vienna during the late 19th century. Today, there are several psychoanalytic schools that adhere to different models of the mind and clinical approaches. And of course, there are many controversies between these different approaches today, although all can be classified as an approach to psychoanalysis. Some key concepts of psychoanalysis, and I will be going more in depth later on in this lecture. The unconscious is a part of the mind containing thoughts, feelings, and memories that are readily accessible to conscious awareness, but still influence behavior. Psychosexual stages of development. Freud proposed that children pass through distinct stages: oral, anal, phallic, latency, and genital, where pleasure-seeking urges are focused on different erogenous zones. Oedipus complex, a psychoanalytic concept describing a child's attraction to the parent of the opposite sex and rivalry with the same-sex parent. Dream analysis. Freud believed dreams were a window into the unconscious mind, offering symbolic representations of repressed desires and conflicts. The ego, id, and superego. Freud's structural model of the mind were the id, which represents basic instincts. The ego mediates between the id and reality. And the superego internalizes moral standards. So again, in Freudian theory, the human mind is structured into two main parts: the unconscious and the conscious mind. The conscious mind includes all the things we are aware of or can easily bring into awareness. The conscious mind, on the other hand, includes all of the things outside of our awareness. All the wishes, desires, hopes, urges, and memories that we aren't aware of yet continue to influence our behavior. Freudian psychology compares the mind to an iceberg. The tip of the iceberg that is actually visible above the water represents just a tiny portion of our mind. On the other hand, the huge expanse of ice hidden beneath the water represents the much larger unconscious. There is some question as to whether the iceberg metaphor came from Freud himself or one of his biographers, as some researchers indicate that there was no mention of an iceberg in Freud's writing. But nevertheless, this is my favorite metaphor of Freud's teaching, the iceberg theory. But let us begin with Sigmund Freud. Perhaps one of the most influential and well-known figures in psychology's history was the founder of psychoanalysis, Sigmund Freud, born in 1856 and died 1939. He was born in Austria and spent most of his childhood and adult life in Vienna. He entered medical school and trained as a neurologist, earning a medical degree in 1881. He was fascinated by patients suffering from hysteria and neurosis. Hysteria was an ancient diagnosis for disorders, primarily of women, with a wide variety of symptoms, including physical symptoms and emotional disturbances, none of which had an apparent physical cause. Perhaps Freud's greatest impact on the world was his model of the human mind, which divides the mind into three layers or regions: the conscious, preconscious, and the unconscious. The conscious basically houses our current thoughts, feelings, and perceptual focus. The preconscious, sometimes called the subconscious, is the home of everything we can recall or retrieve from our memory. And the unconscious, at the deepest level of our minds, resides a repository of the processes that drive our behavior, including biological determined instinctual desires. Later, Freud proposed a more structured model of the mind that better depicted his original ideas about conscious and unconscious processes. Gaining access to the unconscious, then, was crucial to the successful resolution of the patient's problems. According to Freud, the unconscious mind could be accessed through dream analysis by examining of the first words that came to people's minds and through seemingly innocent slips of the tongue. In this model, there are three components to the mind. The id. The id operates at an unconscious level as the motor of our two main instinctual drives. Eros, or the survival instinct that drives us to engage in life-sustaining activities, or the death of instinct that drives destructive, aggressive, and violent behavior. The ego acts as a filter for the id that works both as a conduit for and check on our unconscious drives. The ego ensures our needs are met in a socially appropriate way. It is oriented to navigate in reality and begins to develop in infancy. Now, the superego is the term Freud gives to conscious, where morality and higher principles reside, encouraging us to act in socially and morally acceptable ways. Okay, moving on to defense mechanisms. Freud believed these three components of the mind are in constant conflict because each has a different goal. Sometimes when psychological conflict threatens psychological functioning, the ego mobilizes an array of defense mechanisms to prevent psychological disintegration. These defense mechanisms include repression, denial, projection, displacement, regression, and sublimation. First, repression. The ego prevents disturbing memories or threatening thoughts from entering consciousness altogether, pushing them into our subconscious. Denial. The ego blocks upsetting and overwhelming experiences from awareness, leading us to refuse to acknowledge or believe what is happening. Projection. The ego attempts to resolve discomfort by attributing our unacceptable thoughts, feelings, and motives to another person. Displacement. The ego satisfies an unconscious impulse by acting on a substitute object or person in a socially unacceptable way. For example, expressing the anger you feel towards your boss at work or your spouse at home instead. Regression. Ego functioning returns to a former stage of psychological development to cope with stress. For example, an angry adult having a tantrum like a young child. And lastly, sublimation. It is similar to displacement. The ego overcomes conflict by channeling surplus energy into a socially acceptable activity. For example, channeling anxiety into exercise, work, or other creative pursuits. Psychoanalytic theory focuses on the role of a person's unconscious, as well as early childhood experiences. And this particular perspective dominated clinical psychology for several decades. The psychoanalytic approach focuses on deciphering how the unconscious mind governs conscious processes in ways that interfere with healthy psychological functioning. It is built on the foundational idea that biologically determined unconscious forces drives human behavior, often rooted in the early experiences of attempting to get our basic needs met. However, these remain out of conscious awareness. Psychoanalysis engages in a process of inquiry into adult defenses against unacceptable unconscious desires rooted in these early experiences and emphasizes their importance as the bedrock of adult psychological functioning. Now, we should adhere to the differences between psychodynamic versus psychoanalytic theory and psychoanalysis versus psychotherapy, because we've heard these terms before, but a lot of us use them interchangeably. Psychodynamic theory is an evolutionary offshoot of psychoanalytic theory and keeps key elements of the psychoanalytic theory of human development, psychological functioning, and therapeutic techniques. Psychodynamic theory agrees that clinical problems in adult life often originate in a client's early relationships. It also considers a client's current social context and their interactions with the intermediate environment. Now, regards to psychoanalysis versus psychotherapy, a psychoanalyst has a particular set of skills gained from their specific psychoanalytic training. Meanwhile, psychotherapists can train in a range of therapeutic modalities, including psychodynamic, cognitive behavioral, humanistic, or integrative approaches. However, both professions focus on helping people via talk therapy. Both use their skills to help their clients gain insight into their inner worlds, addressing their psychological problems, and heal. In fact, a psychoanalyst is a type of psychotherapist who specializes in psychoanalysis. Therefore, every psychoanalyst is also a psychotherapist, but not every psychotherapist is a psychoanalyst. Okay, so let's move on. Sigmund Freud was a highly influential figure in the history of psychology. One of his many books, A General Introduction to Psychoanalysis, shared his ideas about psychoanalytic theory. It was published in 1922. Freud's ideas were influential, and you will learn more about them when you study lifespan development, personality, and therapy. I do have video lectures in all of these areas. For instance, many therapists believe strongly in the unconscious and the impact of early childhood experiences on the rest of a person's life. The method of psychoanalysis, which involves the patient talking about their experiences and selves, while not invented by Freud, was certainly popularized by him and is still used today. Many of Freud's other ideas, however, are very controversial. Drew Weston argues that many of the criticisms of Freud's idea are misplaced in that they attack his older ideas without taking into account his later writings. Weston also argues that critics fail to consider the success of the broad range of ideas that Freud introduced or developed, such as the importance of childhood experiences in adult motivations, the role of the unconscious versus conscious motivations in driving our behavior, the fact that motivations can cause conflicts and affect behavior, the effects of mental representations of ourselves and others in guiding our interactions, and the development of personality over time. Weston identifies subsequent research support for all these ideas. Now, more modern iterations of Freud's clinical approach have been empirically demonstrated to be effective. Some current practices in psychotherapy involve examining unconscious aspects of the self and relationships, often through the relationship between the therapist and the client. Freud's historical significance and contributions to clinical practice merit his inclusion in a discussion of the historical movements within psychology. And of course, we could not have this lecture if we could not discuss the many criticisms of Freud. Freud's psychoanalytic theory was faced with extensive criticisms for its lack of empirical evidence, reliance on subjective interpretations, and potential for reinforcing patriarchal norms. Critics also point to its deterministic nature, overemphasis on sexual and aggressive drives, and historical and cultural biases. First, let's review the lack of empirical evidence and testability. Many of Freud's concepts, particularly those related to the unconscious, are difficult to test or falsify through scientific methods. Critics argue that psychoanalysis relies heavily on case studies and clinical observations, which are subjective and can be interpreted in various ways. The theory lacks of empirical support has led to its dismissal by many in the scientific community. Second, the overemphasis on sexuality and aggression. Freud's focus on sexual and aggressive drives as primary motivators for human behavior has been criticized as reductionist and limited. Some argue that this emphasis neglects the important aspects of human experience, such as social, cultural, and spiritual factors. There's also a gender bias and misogyny. Freud's theories have been criticized for perpetuating patriarchal norms and reinforcing negative stereotypes about women. His concept of penis envy, for example, has been widely condemned as sexist and demeaning to women. Critics argue that Freud's view on female sexuality were not based on scientific evidence, but rather on his own biases. Moving on to his deterministic view of human behavior. Freud's theory suggests that human behavior is largely determined by unconscious forces in early childhood experiences. Critics argue that this view negates the role of free will and personal agency in shaping one's life. Freud's interpretations of his patients' experiences were often subject and open to multiple interpretations. This subjectivity makes it difficult to generalize his findings to other individuals or populations. Cultural and historical relativity. Freud's theories were developed within a specific cultural and historical context, and some critics argue that they may not be relevant or applicable to other cultures or time periods. His focus on the individual and the unconscious may neglect the influence of social and cultural factors on behavior. And the overemphasis on childhood experience. While childhood experiences are undoubtedly important, Freud's theory places an overwhelming emphasis on their impact on adult personality. Critics argue that this overemphasis ignores the potential for growth, change, and resilience throughout the lifespan. In conclusion, while Freud's psychoanalytic theory has a profound impact on the field of psychology, it has also been subjected to significant criticism due to its lack of empirical support, subjective nature, and potential for bias. Modern psychology has moved beyond many of Freud's ideas, but his work continues to be studied and debated, and some of his concepts have found their way into contemporary theories and therapies.